But according to records that we analyzed through our research, the usage of e-health service within Sri Lanka is 1%, as it indicated by the blue portion of this pie chart. Another 99% is not using. So we should more concerned to reduce this 99% and increase this 1%. And the National Health Strategic Plan, which is the master plan which runs the e-health infrastructure in Sri Lanka, defined a fully fledged e-health service should be compromised with 4 basic factors. Those are quality, efficiency, patient safety, and cost effectiveness. If I am giving an example how these factors are affecting to the fully fledged e-health service, in a scenario that need to send medical information using the e-health service, let's assume that can be an image of scanned or a patient record. The service should be capable enough to do this in a timely manner with less cost and preserving the quality of information without dropping data. Otherwise, the service will be worthless. It is defining many factors for enhancement of the e-health usage in Sri Lanka in the National E-Health Strategic Plan. But the problem is those should be come into the practice. Furthermore, the National E-Health Strategic Plan again focus on 3 key main areas or processes that should be run in order to easier the implementation processes of e-health services within Sri Lanka. Those are plan and streamline the e-health activities together with ICT, and strive for the betterment of ICT infrastructure and maintain and sustain the programs. In first 2 factors, what it says, the health sector and the ICT sector are 2 different platforms. The bureaucracies and the objectives of those 2 platforms are different. So when executing projects, we have to come to a common platform to achieve our objectives. And it should be continuously monitor and maintain the sustain of the progress of executing processes. So to discuss about the further solution we analyzed through our research, I invite Dewanmini. Over to Dewanmini.
Yes, thank you, Ashen. So let's talk about the enhancements that we can take further. Other than the suggestions that are included in NEH plan, we had found more from the meta-analysis and interviews that we have conducted. The main thing that we have found is the high authorities in government sector don't have reasonable knowledge about the e-health technologies. As a solution for that, we can conducting awareness programs on e-health and what are the advantages of e-health and what are the world e-health achievements. And another thing is we can motivate the universities and other educational institutes to give knowledge about the e-health and what are the advantages of using e-health to the medical students. So through that we can motivate the younger generation to enhance the e-health usage in Sri Lankan government sector in near future. And also we can conducting periodic trainings on how to use ICT in day-to-day healthcare activities to staff who are working in the government sector, and we can conducting awareness programs on e-health, m-health, telemedicine and other related technologies to employees who are working in the government sector. And another main key point is giving knowledge about the e-health to the government sector is not enough. So we should make the public aware about the technological ways of reaching their healthcare needs to enhance the e-health technologies in government sector. At the same time, there are some limitations to overcome those enhancements in Sri Lanka. The main problem that Sri Lanka is facing is lack of computer literacy. Especially the government employees don't have much more knowledge about the computer technologies. So this diagram also shows the computer literacy of government employees according to the final report which was published by ICTAT 2010. And another thing is human resources that we need to enhance the e-health technologies also should be upgraded. Especially we should have technical professionals to enhance the e-health technologies in Sri Lankan government sector. Another main key point is technical infrastructure also should be upgraded, especially the network infrastructure. because health is a critical case and there can be a bugs in the communication. As an illustration, a scan report can have a small change when it handed over to the doctor through the network. So without a doubt, we should enhance the technical infrastructure to enhance the e-health usage in government sector. And also, as I mentioned earlier, we should aware the public as well as the government people about the e-health and what are the advantages of using e-health. By means of conclusion, in our research, we are mainly focused on the current e-health situation in Sri Lankan government sector. According to our research, we couldn't reach that much of e-health usage currently within Sri Lanka. But when we compare with the world, we should try to enhance the e-health usage in Sri Lankan government sector. And currently, Ministry of Health is conducting awareness programs on e-health, and government is conducting training programs to enhance the capabilities in Sri Lankan government employees. And also we should try to mitigate the constraints that we have to make good sound about the e-health concept in Sri Lankan government sector. And so I think our presentation make a good sense about our research that we have done, and I'll take this opportunity to thank our session chair, Professor Gihandais, and the audience for your attention. Thank you and have a nice day.
Okay, questions? So maybe I will start. So what do you propose? For example, as you said, currently it is at less than 1%. Maybe you want to make it, say, 2% to start with. So how do you propose we move towards that?
As I mentioned in our presentation, we can conducting awareness programs for employees who work in the government sector and for the public.
But what would awareness programs itself be enough? I mean, what do we do beyond that?
Yeah, we can tell them to what is e-health, what are the advantages of using.
Maybe I'll ask a slightly different way. Why are they not using it today? What are the obstacles and how can you remove them?
Yeah, because most of the people who are working in the government sector also does not have much reasonable knowledge about the advantages of using e-health. So as a solution for that, we can through awareness programs we can tell them to how we can enhance the e-health in Sri Lankan government sector.
Can I make a comment? But you can make a suggestion I can do. There's a Dompe hospital, right? They have already created one doctor. He has already created a medical information systems and apply and they practically done. So it has already presented in one conference, medical informatics conference in Sri Lanka. So the problem with so I have already attended for that conference. So the problem is when you are going to awareness, so it's not easy. Most of the young doctors, right? Those people are very activate with those sort of things. Most of the senior doctors, medical doctors, they are always reluctant. So most of the IT, most of the doctors, young doctors in the IT, you can educate them. You can get more actively do sort of things.
Thank you for the
I
comment.
think now the PGIM has a postgraduate degree in health informatics. Yes, and I think now the first 2 or 3 batches have. So there is a lot of people who are getting trained in that. They are coming out. They are working in hospitals. So maybe in few years there will be consultants and probably.
Senior people not.
Yeah. No, so sooner or later they will become senior people.
Yeah, that will be.
Yes, please go ahead.
You were mentioning in your presentation that you mentioned that most of the government sector people do not have the privilege with literacy. And may I suggest you that Wikipedia says that according to the population of Sri Lanka in 2012 stats, 20.83 million people in Sri Lanka, and the internet usage is only 18.3%. And then when you're considering Malaysia and Singapore, above 70%. May I suggest that you have to consider about the awareness programs also, but I think the main reason is people thinking about e-channeling mainly based on internet, right? Most people based on internet. So when you considering the internet facility in Sri Lanka, we are also I mean the main districts in Sri Lanka, Colombo and Kanpur. So we are not facing these problems because we are in the also, but the rural areas they do not have the internet connections, and here also we face the internet connections slow down and then all that. So I think as far as my knowledge, considering the technological wise, the internet and that sort of stuff has to implement in Sri Lanka.
Yes, Sri Lanka has already taken doing these projects like Nanasala for the rural area people, establishing more communal centers. So we can by establishing those kind of communal centers in rural area, we can make them aware of using the internet, right? So and by that we can again make them confident in using these kind of facilities, staying at their rural places. Yeah, that. Yes. Yes, all these actions, we have to gradually implement these actions, not at once. So, at the moment, the government is taking its best efforts by distributing these kind of projects. So, near future, I think we'll be able to do.
What is it?
As an example, the rural people can contact with the specialist doctor in the in Colombo through the Nanasala campaigns.
Questions? Okay, we will conclude the session. Thank you.